I described about tracheostomy in detail in last class. The indications, contraindications, then the types of tracheostomy and also the steps of tracheostomy was explained in detail. And to keep a tracheostoma open, to prevent stenosis of the tracheostoma, and to give intermittent positive pressure ventilation and also to give suction. For all that, we need to put a tracheostomy tube through the tracheostoma. In this class, I will explain about tracheostomy tubes, the parts of tracheostomy tube, the different types of tracheostomy tube with the advantages and disadvantages of each one, and the size and dimensions of tracheostomy tube so that you can select appropriate size of tracheostomy tube according to your needs, and also you can understand the complications associated with the inappropriate sized tracheostomy tubes. Okay, so first the parts of tracheostomy tube. I already told you that there are different types of tracheostomy tubes, but in all types the parts are the same. It has got an outer tube or an outer cannula, and also through the outer cannula we can put an inner cannula also. So this is an inner cannula. Okay, single lumen tracheostomy tubes are there, that is without an inner cannula. There are only outer cannula. The tubes with only outer cannula are also there. But when you are asked to explain the parts, tell about the outer cannula or the outer tube and also the inner cannula or the inner tube. Inner cannula is again, some inner cannulas are reusable, some are disposable, and also the plain inner cannulas and also fenestrated inner cannulas are available. Okay, so inner cannulas we can divide it into disposable, then reusable, then fenestrated. Fenestrated means there will be an opening so that it will help in phonation, speaking to the patient. Ideally we use this at the time of decannulation. Okay, and also plain, that is without fenestration. Along with that comes an obturator or an introducer. Okay, so outer cannula, inner cannula. Then at the time of introducing, while you after doing a tracheostomy, you have to introduce it, the tracheostomy tube. So at that time, you can see a thing like this. So that it is introduced through the outer tube, and from the outer tube this will come like this. This will help in easy introduction without producing any trauma. You can introduce it, and it is called a obturator or an introducer. And in a non-metallic tubes come with a cuff also. Okay, here you can see cuffed tracheostomy tubes. So this cuff will help in prevention of air leakage and also prevention of aspiration. And these cuff tubes are contraindicated in children less than 12 years of age. Okay, so cuff is there, cuff, and also this part is called the neck plate or flange. Okay, it is called neck plate or otherwise called flange. The outer one. The neck plate or the flange will help you to fix it to the skin or also tie it around the neck. That is it. Okay. And also in Jackson's tracheostomy tube, this flange has got a lock, a rotating lock, so that the inner tube can be locked. That I will show you along with the different types of tracheostomy tubes. if there are sometimes there is fenestration on the outer tube also. Okay. Usually we, in order to connect it to the ventilator, we use a 15 mm adapter, and that is connected to the inner cannula. Okay. A thing like this. Okay. That is called a 15 mm adapter. To connect it into the ventilator or into a humidifier bag or to a closed circuit suction tube. All these are connected to a 15 mm adapter. So these are the parts of tracheostomy tube, whatever may be the type of tracheostomy. Okay, outer cannula, inner cannula, obturator introducer, cuff, then a neck plate and fenestrator, fenestration and 15 mm adapter, and also some tracheostomy tubes can be connected to a speaking valve, and also decannulation plugs are also available. These are all parts of tracheostomy tube. This is broad classification according to materials used. Types of tracheostomy tubes. There are metallic and also non-metallic. Metallic tracheostomy tubes are mainly made of German silver and also stainless steel, and that is Jackson and Fuller's. And non-metallic made of PVC and Portex and Shiley are commonly used one. All this I will show you after this. Okay. The metallic tracheostomy tubes cannot be attached to or cannot be connected to ventilators. So they are used if we need a long-term ventilation and the patient is not dependent on ventilators. The single and dual cannula. I have already told there is an outer tube and an inner tube. If there is no inner tube, it is a single cannula, and if there is an inner tube, it is dual cannula. Usually single cannula non-fenestrated tubes are used when the patient is critically ill and it is connected to ventilator. Okay, only for suction purpose, right? And it's fenestrated and non-fenestrated. That is an opening either on the outer cannula or on the inner cannula, and that is to facilitate speaking. Okay, and this fenestrated tubes are not to be used immediately after putting a newly formed tracheostomy, because that will cause surgical emphysema to the patient. And also if you are not planning for decannulation, or if we are not planning for speaking, then it is better not to go for a fenestrated tube. Actually this fenestrated tube will reduce the workload or work of breathing compared to non-fenestrated tubes. So this fenestrated tube should not be put in a newly formed tracheostomy and at an acute stage. Okay. And also at the time of giving suction, this fenestrated inner cannula should to be changed over to non-fenestrated inner cannula. So immediately after putting a newly formed tracheostomy, and also at the time of suction, and also if your patient is in acute critically ill condition, it is better to go for a non-fenestrated tube. Okay. Then comes cuffed versus uncuffed. Cuffed tubes and uncuffed tubes. The cuffed tubes are mainly for preventing aspiration and also to give an airtight seal, especially at the time of connection to intermittent ventilator for intermittent positive pressure ventilation. Okay. And all these are different types of cuffed tracheostomy tubes. The form cuff means as soon as you put the tracheostomy tube, the cuff will inflate automatically and it will produce an airtight seal. And tied to shaft, again without giving an overpressure, it will produce a seal. And suction port, usually in normal conditions, in ordinary cuff tubes, at the time of giving suction we have to deflate it. So if the patient we cannot take a chance while in deflating. If there is high chance of aspiration or air leakage, there are tubes available with a suction port to cuff tubes. Then double cuff. like this. There will be two cuff. Okay, if we are deflating one tube, the other one will remain inflated. So we can deflate alternatively, deflate and inflate alternatively. That is double cuff. Then cuffed talking tubes. Usually if we are attaching a speaking valve, this cuff should be deflated. But there are tubes made in cuffed talking tubes are available. And also this Mellincott tracheostomy tube is very effective one with a Lanz controlled pressure system. That is, in long-term tracheostomy with cuff tubes will cause tracheal stenosis and also tracheoesophageal fistula. Tracheal stenosis and tracheoesophageal fistula are two complications of long-term cuff tubes. And this Lanz controlled pressure tubes are available. It will inflate with a minimum pressure of the cuff. And this is a type of cuffed tracheostomy tube working on Lanz controlled pressure system. That is called Mellincott tube. You should remember this. You should study the name. It can be asked in MCQs. Okay. These cuffed tracheostomy tubes are not preferred in children. In children, usually we use Bivona uncuffed tubes or Shiley uncuffed tube and also Portex uncuffed tubes. The length and diameter of trachea is approximately related to the size of the individual. So the selection of the tracheostomy tube should be depending upon the outer diameter, inner diameter and also the length of the tube rather than the size of the manufacturer, because the size of the manufacturer is not standardized for individual tubes. For example, the number 8 Portex tube for one individual will not be fit with the number 8 of a metallic tube. Okay, so it is not standardized for manufacturers. Okay, so roughly the outer diameter of the tracheostomy tube should be minimum 2/3 to 3/4 of that of the diameter of the trachea. Okay, 3/4 that of trachea. So the outer diameter. Roughly the outer diameter is 10 millimeter for an adult female and it is 11 millimeter for an male. So the outer diameter. Okay, and what about the length? Actually, from the flange or the neck plate, there will be an arc shape. The shaft is arc shape and this arc is called the Jackson curve. Jackson curve. This curvature. Okay. This curvature. And this length of the tracheostomy tube, the lower limit should be just above the level of carina. Okay. It should stop with the carina. That is the trachea and the carina. So this should be come here only. And if it is touching the carina, what will happen? It will make discomfort to the patient, irritation to the patient, and cough, and also the irritation will cause trauma to the trachea, and also excessive coughing can cause expulsion of the tracheostomy tube, the granulation tissue formation. Its length is approximately 90 millimeter, that is 6 to 9 centimeter for adult. Okay. For adult, it is 60 to 90 millimeters, and for pediatric age group, it comes to around 39 to 45 millimeters. And for neonate, the length of tracheostomy tube comes around 30 to 35 millimeters. Okay, so this is the approximate length of the tube. I already told, if it is too long, it will come and impinge on the carina and will cause severe discomfort to the patient. And what will happen if it is too short? This is too short. What will happen? this can cause an accidental decannulation, and also the air leak, chance of air leak will be very high. So that should be adequately sized tube, right? And also if you are going for a mini tracheostomy, we ideally use a 6 tracheostomy. That is in emergency conditions. If you are going for a mini tracheostomy, we ideally use a 16 Fg single lumen PVC. Okay. PVC tube. That is for mini tracheostomy. This is used. And also there are tubes, I already told, there are tubes designed for pediatric or neonates, especially uncuffed tubes of Shiley or Binova or Portex tubes. And now let us see the different types of tracheostomy tubes and its advantage and disadvantage. This is Jackson's metallic tracheostomy tube. Actually, Chevalier Jackson is honored as a father of bronchoscopy and laryngoscopy, and he is credited for the newer inventions or newer methods in tracheostomy, and he used his cannula. He called this as a tracheotomic cannula. So this Jackson's tracheostomy tube is made of stainless steel. It has got an outer cannula or an outer catheter or outer tube, and an inner cannula or an inner tube. And this outer tube has got a neck plate or flange. This is called neck plate or the flange. And this neck plate or the flange has got a lock. Actually it is a Sewell lock. Can be rotated. See, it can be rotated 360 degrees. So it is called a Sewell lock. And this is to hold the inner cannula, so that the inner cannula will not get expelled during cuffing. Okay, this is to lock the inner cannula. And the inner tube is longer than the outer tube. You can see it here. Inner tube is longer than the outer tube. And this will help in cleaning. So this can be, the inner tube can be taken out and can be cleaned. And this will prevent the obstruction of the outer tube by secretions. And inner tube can be taken out without disturbing the patency of the main tracheostomy. Okay, so outer cannula, inner cannula, the neck plate or the flange, and again this is obturator or the pilot. This is to facilitate insertion, easy insertion during tracheostomy. And this flange has got area to either to suture this to the skin of the neck, or we can tie thread through the holes and it can be tied around the neck. Okay, so this is Jackson's metallic tracheostomy tube. Okay, and this is Fuller's metallic tracheostomy tube. Again it has got an outer tube which is biflanged. See, it is biflanged. This is for easy introduction. This can be compressed and it can be introduced easily into the trachea. And the inner tube has got an opening here. This is it has got an opening at the shoulder, so the patient will be able to speak. And this is made of German silver, and so there is less irritation to the tracheal mucosa. Actually, this Fuller's tracheostomy tube we use during decannulation. This is at the time of decannulation, the inner tube is plugged and patient can speak because of this valve. The disadvantage is that it cannot be connected to ventilator. Both this Jackson as well as Fuller, because they are metallic, they cannot be connected to the ventilator. They cannot be used at the time of MRI also. Okay, so these two are commonly used metallic tracheostomy tube, Jackson and Fuller's. Shiley's tracheostomy tube. This is available both in cuffed variety and uncuffed versions. This is uncuffed version. It has got an outer cannula and an inner cannula. And this outer cannula has got a flange which is very clear, soft and flexible. Okay, and also it has got recessed borders. You can see the difference. You can compare it with that of Jackson. See the angling of the flange here. See the difference in between. Okay, so here it is recessed. So it will reduce direct contact with the stoma and increases the patient comfort. And also the tip is beveled and a low profile cuff for easier insertion. Okay, and this is compatible with the Cook Blue Rhino percutaneous introducer kit also. So percutaneous tracheostomy kit is compatible with this. It has got a reusable inner cannula option. This is the inner cannula. This is reusable, and maybe it can be cleaned, can be taken out, cleaned and reused up to 29 days for the same patient. Okay, this inner cannula, and it comes with an additional inner cannula also, and there are also suture holes on the flange. See, like in other types there is also suture flange. So outer cannula and an inner cannula, right? And inner cannula has got a lock also, and the outer cannula has got a fenestra or an opening fenestra. This is called fenestra for speaking. And at the time of decannulation, it comes with a decannulation plug. This is decannulation plug. So the inner tube is removed and this decannulation plug can be locked and placed on the outer tube. So the patient can speak through this fenestra also. And in some cases, there is also a speaking valve. Like this decannulation plug, we get a speaking valve also, and this can be connected to the outer tube. This is Portex non-metallic tracheostomy tube. It is Portex, and it is Portex Blue Line Ultra. Okay, you can see a blue line here, Blue Line Ultra tracheostomy tube, and it is cuffed also. It is a cuffed tracheostomy tube, and this cuff allows an airtight seal to facilitate positive pressure ventilation, and also it will reduce the risk of aspiration. Okay, and the integrity of the cuff and the inflation system should be checked before putting into a tracheostomy site. Actually, you have to use 5 or 10 cc syringe, and see cuff getting dilated. Okay, cuff getting inflated, not dilated. It is inflation of the cuff. So integrity of the cuff and inflation system should be checked, and a careful inflation technique to the minimal occlusion volume, MOV, followed by monitoring the inflation volume and the cuff pressure. Okay, so there should be a minimal occlusion volume. Otherwise, there is chance of injury to the tracheal cartilages. And this usually we give around 5 to 8 cc. For pediatric cases, we give 5 cc, and 5 to 8 or 5 to 10 cc in case of adult. And this cuff pressure should be maintained at 20 to 30 centimeters of water pressure. Okay, cuff pressure is 20 to 30 centimeters of water pressure. Again, there is an flange here, and this flange can be connected to the, or it can be sutured to the skin of the neck. It has also got an obturator for easy introduction into the trachea, and after introducing it, this obturator has to be removed and fixed to the tracheostomy site, or fixed to the neck. Then the cuff inflated, and after that you can introduce the inner cannula. Okay, so this is Portex tracheostomy. This is Shiley's uncuffed tracheostomy tube, and again Fuller's tracheostomy tube, and Jackson's tracheostomy tube. These are the commonly used tracheostomy tubes. The other ones I have already described.